Well, Health Minister, there's Dr. Joe Phaahla, will give an update on efforts to contain the cholera outbreak. Now, this as the death toll climbs to 25. 23 of those numbers are in Hammanskraal. And that's where senior reporter ENC's Aviwe Mtila joins us from with the latest on the ground. Aviwe, a very warm good morning to you, colleague. Quite a significant day. This in terms of the Health Minister, Dr. Joe Phaahla, given that update. But the big question is, what are those interventions by the Health Ministry that at this point, with the numbers climbing, are a matter of urgency?
Good morning, Dumelo, and we've been receiving these updates almost on a regular, everyday basis. Yesterday, we had the mayor of the city of Tshwane just telling us on the latest. We heard those numbers there, 24 cases that were reported in the last 24 hours, no deaths as yet. But of course, the biggest concern at this moment is where this outbreak is actually coming from, the source of the outbreak, as initially it was thought that it may have been coming from the Rooiwal water treatment plant that supplies water around the Hammanskraal area, but that has been cleared. And speaking to some of the residents, they don't even trust that, given that some of the taps over the weekend were seeping feces, literally, as they were about to do their hand washing. So they don't trust the water here. And the other struggle then comes in from where they're supposed to be receiving the water. You understand that there's supposed to be water tankers that are crisscrossing the width and breadth of Hammanskraal, supplying water for free. But there are those allegations that these tankers actually demand money from some of the residents in order to get water. I am joined by some of the residents now of Hammanskraal to just understand the situation on the ground, and of course heading to that briefing with the Health Minister at 11 o'clock, what they actually want to hear from Minister Joe Phaahla. Let me start with Mama. Thank you for joining us at ENCA. Where do you get your motor?
Metsaka ke reka mo dishopong ka re ba metsi ha ba tle ka ba feta ba tsamaya ba kwa ba nyaka fela ntshotso fele kona ba tlatla ba o fa metsi ya mo ha ba tle total ke reka fela ka skupunyana se skane ke tla na mo days ka tšhelete mdende ape ke gola mdende ke kresilo ke ka metsi a ditšhila re lwala bona ona no re a lwala ka metsi ao be ke fitile ne ke bereka ke mala ke sa kgone le ya ka toilet ke senyetsa ona mo ntlong ka metsi ao.
So the mother here, grandmother, essentially reiterating those sentiments to Melo that she has to go buy water from the shops. These tankers that are supposed to be coming hardly come here, and when they do, they actually want what they call inchonjo, which is a bit of money in order to supply those tankers. Let me try get through as many residents as possible to understand their challenges. Mama, thank you for joining us at ENCA, but tell us about these tankers and these allegations that they sell water to the residents. Do they actually sell water? What's your experience with the water tankers and getting water here?
Di driver tsa di lorry tse a ba tshwane a se bo botle ba bang ho mmitsa gore a tlo tshella metsi o butse gore o tshwere bokae, so if o tshwere tšhelete e sa lekane e nyakang ba ka se tshelle metsi, so ra sokolla metsi.
So she's essentially saying that it's different drivers, and there are some dodgy ones that actually ask how much you have in order to get water. This water, remember, yesterday we heard from the city of Tshwane mayor, is actually supposed to be supplied for free, and the actual drivers are supposed to be dishing out, handing out permits to show that they are indeed from the city of Tshwane. Siswam, how often do these tankers come around? Because there's a bit of complaint from the two residents that we've spoken of that they don't come around often enough.
They can even stay for 6 months not coming to deliver water here, and then sometimes you will see them passing here and you try to stop, hey, water, they will say it's finished, whereas it's there, and then you hear it has passed, it went to the other road, other street, and then they give them water. So maybe because of they gave them something or what, we don't understand. So we are used to the fact that they don't deliver water. They can only do it once in 6 months, and we've made peace with it. Mara, the painful thing now is that ne re anwa a mo pompong ne bar no wa bona re bano he setse a re lwadisa so hora rena re mo probleming and especially no because of mereko haiteng ka mo o try or o itse keng o balance dilo o balance ka mo tshwantso reke mabone ka mo tshwantso reke metsi a o bereke ba botle ka montlong a le bereke ke tšheleta mo dende fela wa understand or ibi mabang so they hardly deliver. Yeah, it can be once in 6 months.
Once in 6 months. And I understand this challenge of water in Hammanskraal has been a long, ongoing challenge. Tell us about the challenge itself and what comes out of the taps.
Yo, I want to pompong. I don't know because if you can take a white bucket, ne, o tshele metsi. Ka bushu ho bula. O kra gore o ka re seretsenyana se itsekile ko tlase. Gore metsi a teng a di chilne re no nwa because of there is no choice. So we stop and no because of this thing ya cholera. So ne re no nwa because of risk na choice. Gore pila ke challenge engwe e serious ya metsi mo Hammanskraal. Wa bona if lo hore government ne le concern ka rena mo eleng hore they are aware hore na le problem ya metsi and then ba tsia nako hore deliver maybe once a week ba re deliver le metsi a leng skoon ne re ka se be le problem e bya. So no ke problem because of a re kry metsi re ale a tap ne re no anwa re sna choice before cholera ne re sna choice le wa bona re ka ma brown a nkha le makakanyana no because a ona chelete o reka metsi o tlatsa 5 liter mo ke 5 rand. So imagine a family of 7, 5 liter it's nothing. So we have to buy how many liters? 20 at least for the day. So imagine since cholera di 20 rand tse di tswileng ka mo a ona motho a berekang. Wa utlwa re botlhoko bjang bo magogo tshwantsano dipilisi before no pilisi tshwantse a je pele.
So, you know, those shocking sentiments, even the price is mentioned there, 5 rand for 5 litre, but imagine that doesn't even sustain a family of 7, she says, so at least you have to spend some 20 rand a day. But this challenge has been ongoing, and before the cholera outbreak, they had to, you know, consume the water, had no option. They only stopped now consuming the water because of the cholera outbreak, but the challenge has been ongoing and it's been a long-standing challenge in Hammanskraal. Mama, let me come to you. We're going to the health minister at 11 o'clock. As residents of Hammanskraal, what do you want the health minister to deal with? What's at the fore?
Se ke senyaka mo Hammanskraal le ba ahi ba Hammanskraal mo Hammanskraal ra sokola ka dilo tsotlhe diterata tse re nnang ko tsona a dialo ka ke moshima re nna mo moshimeng dilo tsotlhe tse Hammanskraal ba re tshepisang tsona ba thomile ka di RDP ka 2003 RDP tsa teng o fitla ka tsheko le tsona a sinki di ayi re potsa hore re le ba ahi ba Hammanskraal a bana taba le rena ke metsi ha tswa mo dipompong anka tlhapi nako ngwe metsi a tla le lefulo ba etso re government a ina nako ya Hammanskraal total re potsa re na le nako ya dipleke tsotlhe re khopela hore government e be le nako ya Hammanskraal and then ba tse nako ba tlo checka Hammanskraal ba checke di pleke ba checke di tsela ba checke dilo tsotletse re nna le mo pela matamo a rinkhela a re khono robala tsotletse ba to re thuseng le government le thuse ba ai ba Hammanskraal re la bo botle mo Hammanskraal.
So the basic sentiment there, Tumelo, is that government doesn't care about Hammanskraal. It's been years that they've had a myriad of issues. It goes beyond the actual water crisis that they are facing now. There have been promises of RDP houses, promises of roads that were supposed to be fixed, a myriad of challenges that they still face now and then toppled with the ongoing crisis. Mama, but let me come to you as well. We're going to the health minister. Health minister is going to deal with issue ya metsi. What do you want addressed by the health minister?
Metsi ke problem ke mathata maholo ha re bulela mo pompong ho tswa seretse reka metsi a rena tšhelete o reka metsi ke mathata fela.
Just a myriad of issues there painted out by the lady. Mama, let me give you the last bite. Heading to the health minister, I'm sorry to have to rope you in, but I want to understand, give as many communities members so that the government understands the challenge here. Heading to the health minister, what do you want addressed, Mama?
kuminister besicela amanzi aclean, siphuza amanzi angcolile. Sonke lesikhathi besinophuza nje ngoba sizawuthini, kodwa manje sekuwes. Noma siwabilisa aphuma ugwebu nje, ayaphuphuma. So imali yokuthenga amanzi asinayo ngoba sisebenzi, besicela amanzi kuphela into engiyicelayo. Amanzi aclean.
That water crisis, the simple plea, Tumelo, the basic essence, necessity for life. Water, clean water is all the residents want here. They say even if they boil the water as they're told to do so, it actually, some foam comes out of that water. So all they're asking for essentially is just clean water. It's an issue that's been ongoing, given that now it's been highlighted by this cholera crisis, but it's, pre the cholera outbreak itself, it's something that they had to consume because they had no other options. Now they're wary, of course, fearing for their lives, so they're now forced to seek out water from other sources. But even that comes at a cost. If they don't have to buy them at shops, it's these tankers that actually want money from them, which the mayor of Tshwane highlighted yesterday that all of this is supposed to be free. They're supposed to be crisscrossing Hammanskraal on a daily basis, providing water for the residents here. But you hear that it's months on end that the residents don't get water.